Hello, this is Dr. Salem from Brooklyn, New York. Today, we're going to talk about knee effusion as somebody requested. I just give advice here now, guys. Knee effusion happens usually the joint has some fluid called synovial fluid to lubricate. Knee effusion, what are the best solution? I just give advice here now, guys. Knee effusion happens usually the joint has some fluid called synovial fluid to lubricate the cartilage and ligaments and so on, so on, so on. Okay, when the joint, you do something something the joint is not used to do it. Joint try to protect itself, secretes more fluid. Okay, the joint has a capsule. The space is limited. When the capsule is space limited and you have extra fluid, then the fluid become a space occupying. Then it will be difficult for you, difficult to bend the knee, especially bending. Bending will be more difficult and painful. Why? Because the capsule has stretch receptors, that nociceptor receptors. I mean, it's pain receptors. You try to bend, and the capsule overstretches because of the fluid. They give you pain, so have difficult pain with bending. Okay, what is the best solution for if you have knee effusion? The best is called RICE. Let's say RICE. RICE means okay, rest. I for ice. C for compression, E for elevation. Rest, ice, compression, elevation for the swelling. But here what I'm going to show now here. If your knee joint swollen, put ice application. I'm going to show you what the best way to do ice application. The best way to do ice application, never put ice direct on the skin. You get a towel that is wet with warm water, then squeeze it to dry. So a wet towel with warm water, squeeze it dry, wrap it around the knee from mid-leg to mid-thigh. Wrap the wet towel, then get the crushed ice, really crushed ice in a shopping bag. Put it full ice, shopping bag with full of crushed ice, tie it, put it on top of the wet, warm towel. Then get a dry towel, wrap it on top of the ice. Why all this? Ice can cause skin burn, so never apply ice on the skin, especially for long period. That's number one. Number two, when the warm towel, wet warm towel, the warm sensation is soothing, is pleasant. Everybody will like it. Then the cold ice will cool the warm towel gradually and slowly, so it will be like subtle sensation gradually. Will not be better sensation, better cold, better ice sensation to the skin, so the body can take it more and can tolerate it. So this is the best way. And a dry towel on top to keep it, to isolate it, keep the cold for a long time so it doesn't get melted, the ice, and get warm soon. I would suggest to do this for 20 minutes. Do it minimum twice a day. If you can do every 2 hours, please do every 2 hours. If you do something called the Quadriceps Drill with icing every 2 hours, if you can, and you do the local rest. When I say local rest for the knee, mean that no much bending. The movement for the knee is two kinds. Something called open chain, when you move the knee in the air, or close the chain. Close the chain when you move your knee and when touching something or pushing against something like this. Is this the elbow? This is a closed chain. If this is your knee, this is a closed chain. Squatting, there's a closed chain. Sitting and standing, closed chain. Open chain, if you just move your knee in the air, open air. It's called open chain. This is easier for the joint. So no closed chain, no bending, fair. Just when you do stairs, do only go up with the good leg, go down with the bad leg. To remember that the good go heaven, the bad go to hell. So when you this way climbing the stairs, you go up with the good leg, you go down with the bad leg, and no alternation in stairs. Do one leg at a time. Prolonged standing is not good. Squatting is prohibited. Cross sitting is prohibited. Try to keep it stretched, extended most of the time. If you do this and you do what I'm going to tell you now, is called the Quadriceps Drill. Quadriceps drill should be done, I would say, several hundreds. Very good, very easy exercise. Several hundreds a day. Do 100 3 times a day. 100 repetitions 5 times a day. With the icing, it shouldn't take more than 5 days. 4 to 5 days for the effusion to subside with the ice application every 2 hours, minimum 2 times a week, 2 times a day. I'm gonna show now the quadriceps drill. Tighten your leg, make it tight, Haji. You know, make it straight, tight. Yes, this is a quadriceps drill. Contract, good job, contract. You can do that for 20 seconds. Now is Ramadan, if you just want to praise the Lord, yeah, you know, say dhikr, remembrance of the Almighty God. Now relax. Try again. Make it tight. Now relax. Make it tight. You can make it tight for 10 seconds, relax for 5. You can do, you know, 5 seconds contraction and relax 5. But you know, now the muscle to build up the muscle, and this will do suction of the fluids, absorption of the fluids. Okay, this is one of the techniques here. The second after this, you're gonna do after, okay, this you're gonna do like 100 times. It's very simple, very easy. You can do 100 times in one session. It's gonna take a few minutes, like, you know, not much, okay? And after that, you can, after you make it tight, you can just keep it tight, Haji, and lace it up straight. Go straight up, straightly grazing like this, to keep the muscle strength. This is called static knee exercises. Static means you are building muscle tension, you're strengthening the muscles without consuming already over-consumed joint. This is straightly grazing. You can go up and you can come down slowly. Never relax in the air. Keep it tight. Keep it tight. Keep it tight. Don't never relax in the air. Keep it tight. 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 Now relax. Okay. Never relax in the air. Keep it tight before you lift. Lift up. Keep it tight all the time. Keep it tight till you come down. Touch the wrist on the table, on the floor. Then after you be sure it's fully rested, fully supported on the floor, then you can relax. Another way is to do this static knee. This is, we spoke about straightly grazing. We can do a little bit, make it tight, Haji, make it tight. Go up, go higher, go up, go, go, go. Good job, good job, good job. Now we can go inside, go in, go out. Keep it tight, Haji. Out. Go out more. No, out. Good job. Keep it tight more. Keep it tight. Go in again. Go out. Out. Good job. This will be some stretching the hamstring a little bit. You know, stretching the hip adductors as well. Hip adductors are tight, can give you back pain, can give you knee pain. But you know, the sartorius, the gracilis, come up, like, come on, go back in. If the irritable band is tight, now we're stretching irritable band, can give you also knee pain. If the hamstring is tight, calf is tight, can give you knee pain. Make it tight, tight, tight. Now bring it in the middle, come down, keep it tight, come down slowly. Slowly, 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 slowly. Now relax. Okay, another way to do the static knee exercises is if you put a pillow or a ball between the two knees. Squeeze your knees, Haji. No, squeeze together. Hard, squeeze hard. One, no, keep squeezing 5 seconds continuous. No stop. Squeeze them, no stop. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Now relax. Now he's building tension in the adductors here to strengthen the muscles around the thigh muscles, the inner muscles. He will do this and relax. You can do 10 seconds and relax 10. You can do 5 and 5. Depends on your patient. He can take 10. I did 10. It's like we can do also another way for doing the static. You can put a ball or a pillow between the legs and he squeeze it, or you can put we can put a rubber band here, leave him open, and he can also lie on the side and do side kicks. When he's lying on his side, do the side kicks. Okay, now we can do this static also. Open your legs. See how fulcrum here and open hard, open. Now relax, please. Okay, keep your knee straight. Don't move your knee, okay? Keep your knee fully straight and open. Keep your knee fully straight. Open. Now relax. No. Don't bend your knee. Keep it straight. Keep it in the place. Keep it on the floor. Try to open now. Open. Like that. This static also to strengthen the outer muscles. Okay. We can do here. Just push down, Haji. Push down. Hard. Push down. لا تحت. زيادة. This is also another static knee exercises. I'm holding here, pushing down, strengthening the posterior muscles of the knee. We have 4 aspects. You strengthen the front, the lateral, the outer side, the inner side, the back side as well. Okay, you can do can you lie on your side, Haji? Give this here. Okay, we put the pillow between the legs. I'll give him pillow. Okay. Okay, you put the pillow between the legs. Lift up. Keep it straight. Down. Thank you, and Mercedes. Thank you, Mercedes. Bring it down. Up. This, keep your knee tight. This is static also. Don't move it. Don't keep your knee straight. This is strengthen the outer muscles. Bring it down. Slowly, slowly down, slowly down, slowly down. Okay. Keep your knee straight, حجي. Keep your knee locked. خليها مشدودة. شدها مكانها. يبسها. ارجع لورا حبيبي. ارجع علي أنا. تضرب عليها. بس ستريت. لا لا لا. خليها لا لا. أنت خليك نايم على جنبك حبيبي وبس رجلك ترجع لورا كده. برافو عليك. اطلع قدام حبيبي كمان. بطل حبيبي كمان ارجع هنا ارجع بطل ارجع كمان اسد اسد شباب ما شاء الله كمان روح كمان شد 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 ارجع ارجع كمان شد اطلع قدام شد يبس حبيبي يبس روح روح انت بطل روح كمل لو تعبت كثير قول لي ارجع اسد 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 كمان اطلع قدام اسد روح شامبيون لايون كمان شامبيون جو tired okay Go, more. Come back. Here, when you go here, you're stretching the rectus femoris. Earlier you saw us. Good job. And he's now, this also static knee exercises. Okay, and we did, go up and down one more time. Up, down. Okay. Now we're gonna be like strong. Okay, if you have any questions or comments, leave it down. Keep doing this so many times. You can do as you can tolerate. We can start with one set of 8, one set of 10. It depends on everybody has different tolerance, different lifestyle. If he's doing exercise, if he's active, if he's young, if he has comorbidity, if you have a heart patient, have a chest patient, if he has short of breath, if he has other illnesses, you have to be, depends on your patient. Everybody's different. Depends on patient tolerance. Start to gradual, start a little bit, take frequent breaks, do a lot of repetitions, but start it gradually and build up with daily. Okay, but for this, if you do ice, and as we said, the quadriceps drill, and you do ice, as we explained, you do it every 2 hours, and 5 days max, this swelling should be much better in most of the cases. If not, check for something else with diagnosis. Something else, the patient is not following the protocol, he's not doing the home exercise program, he's not following the instructions. Some people, don't do instructions, they go sit down, across set, they go squat and come up, they do stairs, prolonged standing, they don't do the exercises or they don't do the icing, okay? But if you stick with the protocol, from experience, from my patients, people get better with this protocol. If you have any questions, leave it in the comments. Please subscribe, share it with your friends, and stay tuned for live cases from my clinic every day. Thank you now.